Good afternoon. I'm Dr. Gladys Onojobi. I'm an assistant professor at Howard University, Washington, D.C. I'm in the Department of Medicine, Division of Hematology Oncology. I treat cancer patients. I treat blood disorders, including sickle cell disease. My passion for treating cancer patients comes from the background that I am originally from Nigeria, and there a lot of patients and a lot of people don't understand the disease. They don't even know where to get help from. So because of this, and I find myself in a privileged situation where I can impact on the lives of my patients, I decided to specialize in this disorder.
Could you tell us exactly which village you're from, or which group you're from, and just a little bit how you grew up in Nigeria, and what inspired you to do what you're doing now?
Well, I was born in Nigeria, in Lagos, and I went to school in a city called Ibadan. And the reason why I actually went into medicine was because my grandmother had cataract, and then after the cataract surgery, she developed complication and she went blind. And I couldn't understand why it was possible for someone to get treatment and then get complications. And so when I went to school, I decided that the best thing for me to do was to do medicine. And during my training program, I found out all the inequalities. I mean, I was blessed because when we were growing up, we had everything. We had different hospitals, we had facilities. I mean, all the hospitals were working like clockwork. And so, but as I grew and left the university and I started practicing, I found out that the goal and the objective of the government that was there then was not focused on healthcare. It was a way of maybe because the burden of the cost was too much for the government, or there was no availability of making more money in treating patients. The healthcare system totally deteriorated, and of course, many of us left the country to seek for greener pastures. My goal was to train and go back and give back. But when you don't have facilities of where you're going to work, it's so hard to leave the luxury behind and then go and struggle. Cancer, when it's heard, is actually like a life sentence. That means death to most people. My profession is and my passion is to actually give hope where there is hope. Most people hear about breast cancers, but basically cancer can affect anywhere from the head to the toe, any organ at all. The whole problem is when we have checks and balances, just as we have checks and balances in life, we have checks and balances in the body. When the cells get out of control and they start growing, they grow out of control, and they starve the surrounding organs or tissues from having blood. And in that way, all the other organs around them die while they become extremely big. Because of that, a lot of cancer patients, when they are diagnosed initially, might be small, but at the end of the day, they get bigger, and this is what eventually kills the patient. In my country, in Nigeria, patients don't present until the disease is really way out of control, and at that time, there's usually no help that can be rendered to them. As well as you know, a lot of people are doing, especially in the United States or in the Western world, there's what they call prevention and there's what they call treatment. In terms of treatment, in the undeveloped countries, where my country is one of them, the disease is not noticed early, and there is nowhere that actually the treatment is as effective as it is in the Western world. Take breast cancer, for example. That's where you have a lot of money being pushed into, either from private agencies or also from the government. People have to get themselves checked. Once you are above the age of 40, although there are other circumstances that might warrant that you change these guidelines, people have what they call a mammogram, where the breast is examined by a form of X-ray, and these cancers are picked up very early. Whereas in undeveloped countries, the cancers are picked up when it's very obvious and it's big. So in terms of breast cancer prevention, most patients should see their primary care physician at least once a year where they get examined, and then they send them for a mammogram after a particular age. Diet has been one of the ways in which it's been found that you can actually decrease your chances of having colon cancer, although there's a family history as well. If you have a family history of colon cancer, you should be screened earlier than somebody who before the age of 50, which is the usual guidelines in the Western world. In addition, I have a passion for sickle cell disease, which is seen in usually blacks, Mediterranean, and this is a stigmatized disease, whereby in about 10, 20 years ago, the survival, at least the age at which they die, is usually less than the age of 40. But now we have people who have sickle cell disease and live up to 70 years of age, and that's because of good care. Cancer treatment is so expensive that some countries don't even have that budget to be able to treat cancer patients. So eventually patients will end up dying. Now there's a move by the Africans or the third world people to look into the type of treatment that they can offer cancer patients. They are now actually going back into using herbs and finding out those ones that are efficacious in treating cancers, especially breast cancers, and they need the help of their government to set up like research looking into this specifically and be able to compete. Because after all, when you look at the cancer treatment that we have, most of them are from plants. And these plants is everywhere and available for everybody else. It's just the processing and the technology that they don't have that makes it very expensive and prohibited for them to be able to get treatment. So, in addition, testing and, if you want to do MRI or CT scan or PET scans that you use to detect or stage the cancer, it's just so expensive, and we don't have that technology.
Africans still have a culture of going to traditional healers. How do you persuade them that they need to go to use some Western medicine? Or do you think that they can continue to go to the traditional healers like the Sangoma people and so on?
Traditionally, we know that most families will go to, like you rightly said, will go to the traditional medicine first before they seek care. Not only because it's expensive to go to the hospital, it's because of their traditional belief. And therefore, if we let them see that there is certain things, if there's training where we incorporate the two into our healthcare system, whereby the traditional medicine knows where their limitations are, and they can refer to the orthodox physician, I think that would be a very good marriage between the two, and then healthcare might actually be less expensive than what it is at this present time. I encourage my cancer patients especially to use ginger because it's been found to have at least, and when patients feel sick and they are nauseous, if you use ginger, either the tablet form, the raw form, it's effective. And this is something that is available to the traditional practitioners as well. On the other hand, if you were to use medication for the same nausea and you go to the pharmacy to get it, it's expensive. So if you can intermarry the two of them together, I think it will be beneficial. And that's the way I see the future of medicine.